Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's March 2022 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice is an original article entitled, "The Lifestyle-Related Cardiovascular Risk is Modified by Sleep Patterns." It is authored by Dr. Chi-Ying Song from the School of Public Health and Tropical Medicine at Tulane University in New Orleans, Louisiana, Shenzhen Boan Women's and Children's Hospital, Jinan University in Shenzhen, China, and the School of Public Health at Peking University in Beijing, China, and colleagues from 2 other national and international institutions. The risk of cardiovascular disease is critically shaped by lifestyle-related factors such as physical inactivity, smoking, poor dietary habits, and excessive alcohol consumption. The health benefits, including the cardiovascular health benefits of adequate sleep patterns, is increasingly recognized. In the present issue of Mayo Clinic Proceedings, Song et al. Questioned whether sleep may modulate lifestyle-associated cardiovascular risk. The analysis was based on data from the UK Biobank on approximately 400,000 participants without cardiovascular disease at baseline, and in whom there was a median follow-up of 9 years. A lifestyle score was calculated based on physical activity, smoking, alcohol consumption, and diet. The lifestyle score was categorized as favorable, intermediate, or unfavorable. A score for the sleep pattern was calculated based on duration of sleep, insomnia, snoring, daytime dozing, and chronotype. Chronotype is essentially a reflection of an individual's preferred hours of sleep and preferred hours of productive activity while awake. Based on these 5 criteria, sleep patterns were then classified as healthy, intermediate, or poor. The primary outcome of the study was cardiovascular disease, and the secondary outcomes were myocardial infarction and stroke. The data of Song et al. Demonstrate that a healthy sleep pattern can diminish the risk for cardiovascular disease and myocardial infarction that attend unfavorable lifestyles. These findings were recapitulated when a sensitivity analysis was performed. The UK Biobank also provides data regarding the genetic determinants of disease. Capitalizing on such data, Song et al. Demonstrate that in individuals with genetic factors that presage poor sleep patterns, the risks of cardiovascular disease caused by unfavorable lifestyle were accentuated. The benefit of sleep has long been recognized. In Samuel Taylor Coleridge's 18th century masterpiece, The Rime of the Ancient Mariner, sleep gives the mariner temporary respite from his angst. O sleep, it is a gentle thing, beloved from pole to pole. To Mary Queen, praise be given. She sent the gentle sleep from heaven that slid into my soul. Sleep is not only a balm that, at least temporarily, relieves us from the toil and troubles of the passing day, but as shown by the study of Song et al., sleep, when healthy in its patterns, can countervail and mitigate the increased risk of cardiovascular disease imposed by inimical behaviors and lifestyle. The first highlight article in the present issue of Mayo Clinic Proceedings is entitled Comparison of Insulin Spending and Price Between Canada and the United States. And this is authored by Mr. Tyler Schneider from the Leslie Dan Faculty of Pharmacy at the University of Toronto in Toronto, Ontario, Canada, and colleagues from other institutions in Canada and in the United States. Schneider et al. Undertook detailed analyses of spending on insulin and insulin's cost in the United States relative to these metrics in Canada. The analyses utilize data from IQVIA, a major healthcare data science company, pertaining to prescription volume and data cost. The essential findings of Schneider et al. Revealed stark differences between the two countries. In 2018, the United States spent $28 billion on insulin, whereas Canada spent $484 million, spending that reflected in that year $85,498 per 1,000 population in the United States and $12,998 per 100 population in Canada. The insulin user in the United States spent almost 5 times more than the insulin user in Canada, namely $3,494 versus $725. Moreover, over the 3-year span of the analysis, the increase in the cost of insulin was trivial in Canada, whereas such costs increased by just over 10% in the United States. In discussing their findings, Schneider et al. Underscore at least 3 considerations. First, the lower cost of insulin in Canada likely reflects regulatory insulin pricing policies that exist in Canada, in contrast with the relative lack of such policies in the United States. Second, the therapeutic approach that tends to exist more commonly in Canada is that of prescribing the least expensive insulin in achieving the desired and optimal therapeutic objectives. And third, market access for lower priced biosimilars is generally easier in Canada. The much higher cost of prescription drugs in general in the United States compared with other countries continues unabated, and the case of insulin is a particularly striking example. This 100-year-old therapy mitigates the complications of diabetes and saves lives. Surely, the collective experience of 100 years should have led to declining and constraining costs for this essential therapy. The second highlight is entitled Long-Term Effects of COVID-19, which is authored by Ms. Shreya Joshi from the University of Nevada in Reno, Nevada, and colleagues from institutions in Illinois and Florida. As for many diseases, acute and chronic phases exist, and in this regard, COVID-19 is no exception. Joshi et al. Provide a comprehensive review of the long-term effects of COVID-19 based on their PubMed search of the English literature published by July 17, 2021. These authors provide a summary of the epidemiology, pathophysiology, clinical predictors, management recommendations, and unanswered and future directions as these salient issues pertain to the following systems: cardiovascular, pulmonary, neurologic, and hematologic, to multi-system inflammatory syndromes, and to other systems that are much less commonly involved, such as renal, endocrine, integumentary, and gastrointestinal systems. Helpful tables summarize the essential considerations pertaining to these system-specific issues and are preceded by a detailed table that compares and contrasts the key features of acute COVID-19 and post-acute COVID-19. The authors emphasize a management approach that is comprehensive and multidisciplinary in nature, integrating such expertise with approaches that are attentive to and incorporate nutritional considerations, physical medicine rehabilitation, psychological counseling, mindfulness, meditation, and appropriate drug therapy. The authors also emphasize that management recommendations may be tailored to the specific needs of a given patient, and that as knowledge of post-acute COVID-19 evolves, approaches to management may evolve as well. Also in this issue is the original article by Ganesh et al. That analyzed clinical data from the first 108 patients seen in the post-COVID-19 care clinic at Mayo Clinic and the clinical phenotypes so observed. This original work, entitled The Female Predominant Persistent Immune Dysregulation of the Post-COVID Syndrome, is broadly discussed by the insightful editorial by Durstenfeld and colleagues. The upending and blindsiding challenges of the COVID-19 pandemic have elicited innovative responses in so many areas. It is to be earnestly hoped that the same creativity would elucidate the still mysterious post-COVID-19 condition and how patients may derive relief and recovery from what can be crippling symptoms and debilitations. You can access these highlights and editor's choice articles free of charge during the entire month of March. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. There you will find links to our social media by clicking the buttons at the top of the homepage and at the bottom of any page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and Author Insights podcast recordings, which are available from our website on the homepage as well as through iTunes. You will also find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content as well as articles published online in press. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.